Yo fui al doctor porque me había salido que yo tenía diabetes. 45 años tenía cuando me dio tipo 2. Y a él eso de que mi esposo aparece también con diabetes. Así es que hace 22 años va a cumplir hoy que se murió. Sí.
Susanna lived in a very rural area. There's not a lot of resources for her out there. There's not a lot of education available to her, healthy food options for her. She did feel a little hopeless at times. There are no specialists for diabetes in the low desert outside of one provider. And then individually for Susanna, she was really struggling with getting a continuous glucose monitor. Diabetic mismanagement, you run the risk of heart attack, stroke, you can run the risk of kidney disease, you run the risk of a lot of other complications like infections. We all know amputation with diabetics, so there's a lot that can go into it. There's also some acute issues that can happen as well. Really for the members, the only way that they know that they're on track and they're doing well is to monitor their blood sugar.
Yo nunca sentí nada, me mandan a acostar. Pero yo no. Si yo no estoy haciendo nada, yo no estoy a gusto.
The resources to buy blueberries and grapes constantly, it's okay to not.
I don't think it was until she really saw that she had the support system around her, meeting with her in her home.
So they're going to help with the.
I visited Susanna. I think that was a huge game changer for her, is actually knowing there are IEHP workers that are willing to drive all the way out to Mecca to see me to work on my problems. She expressed a lot of concerns to me during that visit, and afterwards I reached out to Dr. Chang's office and relayed some of these concerns to them.
But I also educate them about important.
We were able to do an in-service to show what the CGMs could do, the benefits of the CGMs, and then actually how to properly fill out the forms and submit to IEHP. That way it kind of alleviated that gap for not only for Susanna, but for all the members that they were struggling to get them with.
Aquí me encontré con ese doctor, que ese doctor, uy, Dios guarde, ese doctor es magnífico, ese es buen doctor. Yo no había encontrado otro doctor como él.
For now, I want you to check your blood sugar with
Ellos me han atendido bien, me tienen al pendiente, que como estoy, que hasta digo yo, y esto que tanto habla. Y digo yo, pero es para mi bien, ¿verdad? Y le digo yo a mi hija, mira, esos están más precisos que yo, están más preocupados que yo, le digo yo. Ay, sí, mami, me dice, pero tienes que ir, me dice, sí, le digo yo, tengo que ir.
I'm going to see if I can get you a new machine so we can get a more accurate blood pressure, okay?
A lot of people think this is the end of the world. I'll never get to enjoy a normal life ever again. And that's really not how it is. And especially nowadays with the technology we have and the monitoring and oversight we have. These CGMs, they're really changing the game with diabetic management. This is the future of diabetes control. It's a sensor. You change it out about every 2 weeks. It usually goes on the back of the arm. You can pull up either a separate device that's provided to you, or you can pull up an app on your phone and get real-time alerts when their sugars go high or when they go low. You can check it 45 times a day, twice a day, it doesn't matter, but this really gives members real-time information of how well you're managing your diabetes.
How are you doing? The ultimate reason why I wanted her to have a glucose monitor is for her to see how her blood sugars are changing, getting impacted through her diet, and also respond to emergency like hypoglycemia. This could be life or death for a lot of patients, and in her case, it has saved a lot of hospital trips. I felt like for her that if I didn't do this, that she might have passed away from diabetic complication.
The most important thing I would say is don't ignore it. Don't pretend that the issue isn't there with diabetes. Have a good conversation with your primary care doctor and reach out to people that can advocate and help for you.